Why do we get hiccups? Hiccups are sudden, involuntary contractions of diaphragm. Causes of hiccups. Transient causes which last for seconds to minutes are stomach distension, swallowing of air, smoking and intense emotions. Persistent causes which last for greater than 48 hours include general anesthesia and intubation. Chronic causes which last for more than a month include pericarditis, laryngitis, gastroesophageal reflux disease, disorders of CNS and medications. Treatment for transient causes include drinking glass of water, cold compress to the face. Interrupt the respiratory cycle by holding one's breath for several seconds. And Valsalva maneuver. For persistent hiccups, pharmacological and surgical treatments are advised.